Hello, you guys. Today I would like to discuss endoscopes and why they are one of the most difficult medical instruments to clean and maintain. First, I would like to explain what an endoscope is to those who do not know. An endoscope is a medical instrument with a long, thin, flexible tube with a camera and light source used to visualize the inside of the body. It allows doctors to view organs and structures on a monitor to enable a diagnosis and treat conditions. Endoscopes are used in a wide range of surgeries, including arthroscopy, which is joint surgery, laparoscopy, which is abdominal surgery, and also colonoscopy, which has to do with the colon and rectum for signs of disease. There are several other surgeries that endoscopes are used for, and I will post a link at the end of this podcast, and you guys can check that out for more surgeries that endoscopes are used for. But the reason why endoscopes are important is because they lead to an earlier detection of disease and improves patient outcomes. The earlier the disease is found, the better it is for a doctor to properly treat it. The further off that the doctors find this disease, it'll be a little bit more complicated for the disease to be treated. Next, I would like to go on to why are endoscopes difficult to clean and maintain. First, the design of endoscopes has internal channels that are only a few millimeters wide, and some may have channels that merge, complicating the cleaning process. During procedures, these channels become contaminated with various debris, including blood, stool, tissue, and saliva. According to the Journal of Hospital Infection, bacteria can form biofilms on the inner channel, which also makes it difficult to disinfect as well. Due to the delicacy materials that these instruments are made of, they cannot withstand high temperatures of steam, typically that are used for other surgical instruments. And so that leads to why they do the manual cleaning to prevent risk of infections, disease, and contamination. But even though with the manual cleaning, there is still a concern that is prone to human errors. And those factors include like rushing to clean the instruments or using incorrect cleaning tools, skipping steps, or improper handling that can lead to inadequate cleaning. This is why all staff in the sterile department should understand the importance of cleaning, disinfecting, and sterilizing each instrument and tool properly. Next, I would like to speak on the steps that are involved in the reprocessing of an endoscope, and that would include the pre-cleaning process. And that is the pre-cleaning is at the point of use, which is immediately after the procedure. The exterior of the endoscope is wiped and channels are flushed to prevent that buildup of bioburden and biofilm. The pre-cleaning should be done within 60 minutes of the procedure. Otherwise, additional steps and reprocessing must be followed. And whoever that staff member is that is cleaning that product should be well aware if surgery stops at 12:30, that instrument and or tool needs to be back in the back being cleaned directly before 1:30. The type of material they are made of can be easily damaged and must undergo a leak test. It can be done manually or with an automatic leak tester. They will flush the channels, particularly with a solution, to see if there are any punctures, rips, or holes, causing the internal solution to leak on the exterior portion of the endoscope. As I stated before, the manual cleaning is necessary to focus on trying to remove all visible debris, both inside and out. According to Steris, this process includes cleaning with brushes, enzymatic detergents, and flushing all channels. There are two types of solutions for the cleaning process. One is the HLD, which is high-level disinfection, which eliminates all microorganisms except bacterial spores. Another is LCS, which is a liquid chemical sterilization that eliminates all viable microbial life, including bacterial spores. So the LCS is kind of better. No, the LCS is better than the HLD because it removes all microorganisms and bacterial spores, preventing further contamination or disease to the patient themselves. Although manual HLD can be done, AERs are recommended to ensure the cleaning has been done properly versus human errors. After the proper cleaning has been done, the instruments must be thoroughly dried to prevent the growth of any missed or left behind microorganisms. For this step, as we all know, alcohol dries up a lot of moisture, not all moisture, but a lot of moisture that is left behind. The channels inside and out of the endoscope is wiped with the alcohol solution and force air to the instrument to completely dry it up. When putting the instrument up for storage, it should be placed vertically to allow air circulation. When this endoscope is ready to be used, it must be carefully handled during transport to the operating room to prevent recontamination. These are the steps in explaining why endoscopes are difficult to clean and maintain. And I also want to go ahead and talk about whenever I had an endoscope used on me, I had some complications going on, and I ended up having to get laparoscopy surgery. I had a cyst on my ovary, and it was causing me to have night sweats. It was causing me to pass out, and I had no clue on what was going on. So I scheduled an appointment. Well, I actually went to the emergency room, and they ended up sending me to the hospital. And when I got to the hospital, that's when they used an endoscope to go in and view what was going on after I had got the, what is it called? They viewed it on the monitor, and after they viewed, they did like a scan. After they did the scan on the monitor, that's whenever they scheduled my appointment to come back because they seen the cyst on my ovary from the monitor. So when I went back, they had me to not drink anything after 12 o'clock that night. And I got back to the hospital, they had me to drink a big, I think it was like 1 liter or 2 liter gallon, it was a gallon or something it was. I can't really remember because it was so many years ago. But they had me to sit there and drink all of that fluid. They could not do the procedure without me drinking all of that fluid. They wanted to blow my stomach up to have a better image on whenever they put the endoscope in. So when they went in with the endoscope, they seen how big the cyst was, and the cyst was on my ovary. And they ended up having to do the laparoscopy surgery. The size of the cyst that was on my ovary was explained to me that it was the size of a grapefruit. I just wanted to share that with you guys, just letting you know how important it is to go ahead and seek medical attention if something is going wrong with your body and you notice changes. You never know what can be going on internally. You may look fine on the outside, but whenever you feel that your body is changing and something is wrong, I suggest that you go ahead and seek medical attention immediately. I could have lost my life if I continued on and not said anything about how I was feeling, about the sweating and the feeling faint, dizziness, and almost passing out. If that cyst, I was told by my doctor, if that cyst would have burst on the inside of me, it could have been deadly, and it could have also caused other internal issues within my organs and everything else. So to my listeners, in this podcast, if this has further educated you, I would recommend to continue and study more reliable research, practice cleaning endoscopes, and going over the information for use, the instructions for use, sorry about that, the instruction for use manual to get further information on how to properly clean endoscopes. With those endoscopes, if you are already having complications, going inside of you with a non-sterile endoscope could really further your complications and make things worse within your body. So that's why I wanted to talk about endoscopes, because I kind of had an experience with it myself. I'm not sure if anyone else had any experiences with endoscopes or not, but it's very important to keep these instruments clean to the best of your ability to prevent and ensure patient safety. I thank you guys for having me as a speaker, and if you would like to stay tuned for the latest updates or any other future podcasts that I will be doing, then I would be more than welcome to do more podcasts. If you could just comment below and let me know more information on what you would like me to speak on next, I'll make some more videos. But thank you so much and have a great day.